Hello everyone, this is Saad Abdul Jabbar, MHA 575, Current Events in Healthcare. And today I'm presenting the third current event about patient care and economic need. Healthcare and economics have an important relation when it comes to improving health, like improving the outcomes of patients, improving resources used, and getting the most from the available resources and the efficiency in the resources used, which all will lead to less diseases and a decreasing in healthcare spending. And these steps can be done by improving technology and improving the adoption of technology and increase patients' engagement in their health and also increase patients' satisfaction. So let's start this presentation by having a brief history of healthcare spending. After that, I will discuss some of the point of views on healthcare in the future in 2030 and 2040. And following, I will talk about the 6 factors contributing to the reduce in healthcare spending and a conclusion of the whole subject. The timeline of the healthcare spending in the United States. So, by looking at this chart of the history of healthcare spending through the 1970 until 2019, in the 1970, the GDP, the gross domestic product of the United States, was 1.073 trillion dollars, and the spending on healthcare accounted for 12%, as you can see here in with the gray color of its GDP, which accounts for $75 billion dollars, or $356 per person. And since the 1970, the spending started decreasing, as you can see, until it reached the 2010. There we can see a little bit of a raise there in the GDP. The United States spent $2.6 trillion on healthcare in 2010, spread over the population. This amounts to $8,402 per person. While the period from 2010 until 2013 and 2016 to 2018 saw an average annual growth rate in health spending similar in growth of the GDP. The health spending did pick up in 2014 and 15 with coverage expansion of the ACA, the Affordable Care Act, and growth rate has been stable in years since. And nowadays, the CMS in the report estimated that national healthcare spending reached $3.81 trillion dollars in 2019, and it would increase to $4.01 trillion dollars in 2020. And it is estimated also that in 2020, per capita health expenditures will be more than 12,000 US dollars. Healthcare in the future for the next 2 decades. According to Dr. Eric Topol, a founder and director of Scripps Research Translational Institute and one of the most influential doctors in human medicine, he has a positive perspective about the healthcare system in the United States for the next 10 years, so by 2030. He believes that the existing technology that we have nowadays and all the new advanced electronic technologies and devices that is going to be there and that's going to affect us and all patients in the future will make a substantial contribution to the standard of care for these patients, and that again is by 2030. So, as we have all seen, the COVID-19 pandemic will definitely speed up the digitalization of healthcare industry in the United States and also in the whole world, especially in the areas of telemedicine, mobile health, and electronic devices and medtech. So when we're talking about electronic devices, these devices include the wearable monitors, environmental sensors, and other devices that actually offers real-time and reliable data and reliable readings that is between the patient and their healthcare providers in order to avoid, control, and reduce the bad outcomes from a specific condition. The digitalization also include a huge storing and sharing of data through specific applications and also through the system in the healthcare system, where these proper data will often prevent and mitigate and reduce the poor conditions in a society. So, for example, we have a study of asthma patients where the use of proper statistics of how many people have asthma in this region of Louisville to provide them with inhalers to reduce asthma attacks. They found a 50% reduction in asthma attacks following providing the inhalation in this area, as well as a 70% of reduction in the need for inhalation. And this study demonstrates and shows that the prevention of a disease is feasible, particularly with the reliable use of data, and especially if it was used to support patients. Contribution to healthcare. There are many topics that talk about the change of healthcare system before the pandemic hit us, which were about how the perspective on how the business of healthcare will transform by 2030 or 2040. After the global crisis of COVID-19, actually the COVID-19 demonstrated and exposed how vulnerable and how it's the healthcare is at risk, the healthcare industry, and but it did actually boost the idea of need for change right away. And I'm going to talk about this in the next slide, as well as showing where the system requires significant progress. So in the future, rather than focusing on clinical care and diagnosis, the future would actually focus more on the engagement with the patient, with patients themselves, that will have a new business model and models and new technologies, which will have the huge impact on the healthcare industry. But in this slide, we also have the 6 factors that will have this huge contribute to reduce the speed of the growth of healthcare costs in the future. That we expect, well, all of these factors will together transform the existing health system from treatment-based and receptive care to prevention and the well-being for patients. And these include the data sharing, interoperable data, equitable access, empowered consumers, and behavior change and the scientific breakthrough. The financial impact of each area of these six aspects will likely differ based on the timing that it might be in fully effect, intensity, and the expenditure category. Data sharing. So for the first aspect, data sharing is already happening. Also, the COVID-19 pandemic forced healthcare facilities with governments to push data collecting and monitoring to a new standard to improve the healthcare industry, which started an improved exchange of information, including major corporations such as Facebook, Google, and Amazon, which have launched a range of new data-based projects in the area of resource management and public health. Some of the data sharing examples, like the huge national efforts by Trump administration to collect and share data on COVID-19 testing, bed capacity, and supplies in different hospitals in order to track the spread of the disease, while also knowing that the new technologies would help in store these data in the system, speed the process with more accurate and proper treatment. And these are, like I mentioned before, the wearable devices, applications, the wearable devices that's connected to the patient to exchange the information and provide usable information to the healthcare provider to care for the patient. According to Deloitte, after research they have done on sharing data, it shows that 46% of patients are willing to share their medical information with health plans and their physicians, and 20% have already used technology to measure and share medication data with their doctors. For example, the Apple Health Records feature is now open to all the United States healthcare organizations with compatible EHR, the electronic health records. Interoperable data. The United States Department of Health and Human Services finalized two transformative rules that will give patients new, safe, and protected access to their health records. Interoperability has been requested by several states and various regulations, and these rules now finally guarantee that people have true access to their health data in order to make rational healthcare choices and help control their care by themselves. The patient control is a primary aspect to Trump administration work for a value-based healthcare system by putting patients in charge of their health records. It is an important part of allowing patients a greater power over their healthcare. So after January 1st, 2021, plans on the federal exchanges will be required to share claims and other health information with patients in safe, secure, understandable, user-friendly electronic format through the Patient Access API with more complete data in their hands. Patients can be more informed, can make like more informed decisions, leading to better informed treatment. Equal access is the third aspect contributing to reducing healthcare cost, which means that the patients who are not able to access the health system when they are in need, they might end up getting worse health conditions. There are several types of providing this equal access, such as the urgent care, walk-in clinics, and the use of telemedicine or telehealth and virtual care, which made it easier for many people to meet with their healthcare provider and seek the proper treatment. Again, these Stay-at-home orders and the lockdowns during the pandemic increased the adoption of virtual care, specifically with vulnerable populations. A COVID-19 survey by Deloitte shows that 26% Medicare patients used telehealth or virtual health during the first 4 months of 2020, while knowing that before the pandemic it was accounted for 13% for people who use the telehealth or the virtual care through the whole year of 2019. Empowered consumers. By increasing the use of technologies and virtual services, patients are providing more customized healthcare, increasing their control of their own health data and increasing their sense of responsibility for their own well-being. And I believe this is going to increase the health literacy for patients, which actually increase like how good a patient can obtain and process and understand actually the basic health information and basic services that actually is needed to make the proper health decisions, as well as the digital literacy, and also it increased the shared decision making for a better desired health for each individual patient. So there was more than 40% of surveyed patients that used devices and technologies to measure fitness and health improvement goals, comparing to 17% in 2013. Behavior change. Lifestyle improvements are hard to achieve and it can be much more difficult to maintain. But evidence-based lifestyle intervention plans and methods are available and have been shown to make it easier for pre-diabetes people to lose weight and decrease their chance of having type 2 diabetes by half. According to Deloitte, uh, if implemented properly, data science and behavioral economics will lead to positive behavioral improvement. And these such as wearing activity tracker combined with goal setting and competition and gamification would actually increase the physical activity between patients. Scientific breakthrough. The pandemic has led some efforts to conduct more on emerging technologies for clinical studies, as we have seen how many pharmaceutical companies partnered together to produce and sell a COVID-19 vaccine. And an example of that is how Pfizer and Moderna companies developed the COVID-19 vaccine with above of 90% efficacy. Over the next 20 years, 30 years, we hope to see new preventive and curative developments at an outstanding and faster levels. The biopharmaceutical companies are expected to begin discovering innovative methods to avoid, treat, and potentially cure a variety of diseases through vaccines and advances in cell and gene therapy. And again, with all the new technologies in the future, it is expected to be used to help care, to help healthcare providers and also patients to detect illnesses in patients and maybe even before it happens, or if if the patients were more likely to develop certain disease and how they might actually avoid it. In the end, there is no doubt the future of healthcare will be characterized by the rise of technology, where it is expected that these six factors that I talked about, including data sharing, securing data, equal access, engaging patients, behavior change, and the scientific breakthrough, will help shift the spending from areas of waste to investment that actually improve individuals' health and help to minimize the rise in health spending. So as well as increasing the patient health and the outcomes, it will increase patient satisfaction and improve the healthcare industry overall, and that's by 2040. And that's it for today's presentation. Thank you so much for listening, and see you in the next one.